Thank you for joining us at the second Canna Talk webinar. We're thrilled to have everyone here on this learning journey with us. A few quick announcements before we get started. Please keep your microphone muted throughout the presentation. We will read all questions aloud at the end during the Q&A session, so please type your questions in the chat at any time. We'll be keeping track of those. We're glad to make this live webinar free and open to everyone, all SCC members and non-members alike. All Canna Talk recordings will be freely available to members and available for purchase to non-members as well. Please be sure to join us next month on May 27th during Mental Health Awareness Month as we host Dr. Zachary Walsh, who has authored 2 of our mental health courses in the clinical training curriculum. Thank you all so much for being here again, and I will pass the mic over to Dr. Patricia Frye as we get started.
Well, good morning to some, good afternoon to others. Welcome to our second edition of Canna Talk with Frye and Wilson King. We are really excited to see all of you who have tuned in today and can't thank you enough for your continued support of the SCC. Dr. Wilson King and I are pleased to bring you yet another educational discussion on the clinical use of medical cannabis and how our very favorite ancient plant is helping to improve the lives of patients everywhere. So today we'll be exploring the conversation of neurodegenerative and movement disorders, featuring our very special guest and author of our module, Dr. Stacey Kerr.
All right. Thank you. Welcome everybody here. This is Dr. Wilson King, not Dr. Kerr, but I want to introduce her to you because she is a very special guest. She is a teacher, an author, and family physician. She's a graduate of UC Davis Medical School. And after several years of working with the SCC, and she was the co-director of the very first SCC set of modules, which is outstanding because she and Dr. Malka put the SCC on a different level. So she is now an advisor for Hawaiian Ethos, or was an advisor for Hawaiian Ethos LLC on the big island of Hawaii. Dr. Kerr is now a freelance physician that practices with a special interest in the medicinal use of cannabis. Without further ado, we are pleased to introduce you to this phenomenal physician and leading expert in medicinal cannabis, Dr. Stacey Kerr.
Thank you, Jenister. That was a very generous introduction. I appreciate it. I'm honored to be here. Honored to be here. Yeah.
Well, we're definitely honored to have you. And I want to, earlier we were talking, and I want you to share how you came to be, how you got into cannabis medicine. It's a great story.
Thank you. Thank you. Well, I grew up in the 60s and 70s, of course, and you can tell by the color of my hair. And I never imagined that I'd be sitting here, frankly, talking science and cannabis. I should live so long. But when I was in practice, I had my own practice in family medicine, I had a patient who was also a friend who had cancer and was getting treated, and she had never used cannabis in her life, but I knew from other experiences that she might benefit from it, at least to help her with the side effects of her chemo. And so one day, when I had the day off, I went out to her house and took some flour with me to offer it to her. And we walked into her house and she was dragging, she was trying so hard, but you could tell she was gray. She hadn't eaten in a couple of days because of the side effects of chemo and the cancer. And so I asked her if she was willing to try to inhale a little. And she had a small cell lung carcinoma. She'd never smoked, but her cancer was in her lungs. So I considered, should I even have her inhale any of this? But I wanted some rapid effects. I wanted her to see benefit, if there would be any, as fast as possible. So she agreed. She said she would be willing to, with a little trepidation. Her husband was gone at the time, which made her happier because she wasn't sure how he'd feel about this. So, of course, we didn't have a pipe or papers or anything, so I went to her kitchen and I found a glass teapot, and I filled the bottom with a little bit of water, and I took some foil and covered the top with foil and poked some holes in it, and put a little bit of the flour there, and we took it out to her on her deck that overlooked this huge valley. And I told her to take just a couple of short, shallow inhales off the spout of the teapot. And she didn't have to hold it, just in and out, just two and stop. And so she did, and then we took the teapot away from her so she wouldn't have to get upset about it. And I'd say it was about 5-10 minutes, and everything changed. She started looking at the view and appreciating what a beautiful day it was out there. She started joking with us. The color came back to her face. And when her husband came home a few minutes later, we're all three of them, because three of us, I took a friend with me. We were out on that deck laughing and talking like three girlfriends. And he came out and he was confused and a little concerned, but also pretty joyous. What's going on out here? And we showed him the teapot. And I saw these changes go across his face about integrating what we'd done, but then looking at her and what it had done. And then she said, would you fix me a smoothie, please? And that did it. He went inside, he made her the smoothie, he brought it out, and it was a wonderful visit. But what it did for me as a family physician was it outed me. I was no longer afraid to talk to my patients when it was appropriate, and to start learning how to incorporate it into people's lives as true medicine for medical problems, not a general medicine for state of mind, if you will. Mm-hmm. And that started my path on following the science that we have had and we continue to build around the plant. And that's just one isolated incident that affected me strongly, to know that this is good medicine for some people in some instances. And I continue to see miracles like that. If you are able to see the module I created, there's an awesome video of a gentleman with Parkinson's disease before and after he smokes marijuana for the first time. Yeah. It's dramatic, and the side effects are not fatal. I love it.
Yeah, it's Dr. Kerr has some really good modules, good videos in her module that are fascinating. You know, many of us cannabis clinicians have our stories about how we really came to cannabis. So thank you for sharing that, Dr. Kerr. So let's talk a little bit more about your module. Which conditions do you actually cover in your module?
Well, I had time to cover Parkinson's, Huntington's disease. There's a great video of Huntington's disease in there. Essential tremor, multiple sclerosis, restless leg syndrome, and finally Alzheimer's.
Mm-hmm. Very nice. Very nice. I'll tell you something.
I'm sorry.
I'm sorry. Go ahead. I interrupted you. Go ahead and finish.
Just this Zoom thing, you know, we can't talk over each other, right? It's many of these conditions have similar base problems that lead to that condition. The base problem being neuroinflammation that leads to neurodegeneration. So we're dealing with a couple of obvious things: decreasing inflammation, trying to stop the progression of degeneration, and then each one has its own still somewhat confusing profile that we're still trying to tease out, not only what causes the condition, but what can affect that to not only improve symptoms, but to stop progression.
All right. Thank you. Thank you. I have a question. I'll tell you why I'm asking it after I ask it. ALS is a progressive neurodegenerative disease. And I noticed you didn't include that in your module. And the reason I'm asking is I just got my first patient with ALS. So I ran to the module
Oh,
and
that's
looked to look and see, oh, what did Stacey say about it? But it wasn't there. So can you tell me why that
Yeah.
was not included, please?
Well, yes. I wish it had been, but one pretty clear reason, I only had time to do so many in that 1 hour module. So I had to weed out the ones that I had very little data to share.
Right.
ALS is one of those. First of all, we're at the need clinical trials stage. So I deemed it not, I'm sorry to say, I don't mean this like that, but not worth the segment because I had so little science to share about it. But I can say here that the effects of cannabis as a neuroprotective medicine and the effects of cannabis on spasticity in other conditions make it one that we really should be getting more data on and studying.
Mhm.
And if I had a patient with ALS in front of me right now, I would certainly go ahead and start doing my own trial N of 1 with the information that we have from these other conditions, like the effects of THC on spasticity. My ALS patient has spasticity. Let's try some THC and see if it works. And then not only will it help you, but then I can share it with somebody else.
Right.
That's the level we're at with ALS. And so I couldn't really cover it in a worthy educational module right now.
Totally
Do we
understand.
know what, oh, I'm sorry. Do we know what, by which mechanism the cannabinoids cause muscle relaxation or assist with muscle relaxation?
Yes, we know a little bit. I have notes on that here. Excuse me while I look, but it has to do with the CB1 receptors, and yeah, here it is. It is. We know that if we have mice who don't have CB1 receptors, the medicine doesn't work on spasticity. But we're still teasing out all the effects from that. And it says the endocannabinoid system may modulate muscle tone and reduce spasticity by acting on presynaptic CB1 receptors to reduce glutaminergic transmission. Now, in English, it looks like the CB1 receptors are necessary for the anti-spasticity effects. And it also ties into glutamate, which is the big problem with inflammation excitotoxicity. And I'd like to explain excitotoxicity for just a minute, if that's okay.
Sure.
The excitotoxicity is at the core of many of these effects with cannabis. In the brain, with inflammation, the brain releases glutamate, a product, and that helps. Glutamate is out there to do a good job, but in some cases, glutamate gets released way too much. We get flooded with glutamate. The door's open and it keeps coming. This is a problem. Too much glutamate around neurons allows calcium to go inside the cells where it shouldn't be in those amounts. When it gets into those cells at that amount, it destroys cells. So basically, a good function gone bad by overproducing glutamate is actually destroying cells. This is called excitotoxicity because we get all excited and then we get so excited we're toxic. If we can control that glutamate flood, then we can decrease the degenerative part of these diseases and somewhat stop the progression of some of them. So a lot of work has gone into looking at what can affect glutamate and the toxicity of too much. So if the CB1 receptor is being stimulated, mostly by THC in this study, that can decrease the glutamate that's being expressed, and then that can somewhat slow the degeneration. And that's true across many of these illnesses.
Yeah, I would think that CBD and CBG also would be effective in muscle relaxation, since both of them reduce glutamate through similar mechanisms. And it may not be by the CB1 receptor, but by another, by acting directly on those glutamate receptors. Interesting, because we see that in autism with this neuroexcitability, not necessarily the pace of degeneration that we see in these other adult illnesses, but we certainly do see it in children with autism. Yeah.
Well, CBG is, there's some information in the module about CBG and Huntington's disease. A little bit of work was done on that. So CBG is coming up in the work we're doing. And in addition to, speaking again to spasticity, it's a multifactorial symptom. And I know that one of the few medications that's been authorized, has been okayed, is one for MS spasticity. And it has both CBD and THC in it. So both help. And so the placebo effect is relatively high in treating spasticity. I'm not saying it's as high as the real effect, but there is a significant placebo effect to treating spasticity and some of the other symptoms with cannabis. And I think that has something to do with the multifactorial causes of these symptoms.
It may have something to do also with that whole enteric nervous system and the you know, as you relax mentally, perhaps the signaling in the gut changes. So who knows? It's the same thing with kids with autism. There's a big placebo effect. Yeah.
And, you know, speaking of spasticity, I love topicals. Topicals really are effective in many, many areas. Are topicals effective in reducing muscle spasticity?
I looked at that issue when we were talking about this a little bit earlier, I know. And I like topicals a lot. I actually make my own salve in my kitchen here because I wanted to put in some herbs I liked that weren't in some of the products for sale. So I'm a home medicine maker here. Looking at the science, technically it shouldn't help that much because it's not getting into the receptors in the brain, and yet people experience some relief. Is it a localized effect? Perhaps. The science, I couldn't find science on that, but we know massage helps. And if you're massaging in the salve, and I know with the salve I make, people say, well, I don't want to go walking around smelling like pot. And they go, no, this is how you use it. Take the salve and you rub it into the area of need, and you keep massaging it in until the scent is gone. Then you don't smell, and then it's in deep enough to do its job, and you're giving yourself a good massage. It's even better if you can get somebody to do it for you, but it needs to be rubbed in well. And I believe salve is also a really good entry method of administration. A lot of people with these problems are elderly, and many of them have never used cannabis at all, and they're pretty terrified. Like, what am I doing? Oh my gosh, I'm going to turn into a zombie. We know this. And if I can start them on a salve and they don't turn into a zombie and they actually feel better, then they're a little more amenable to taking maybe one milligram of THC. Maybe that's all they need. But it's a way for me to desensitize them to the fear and give them some benefit at the same time.
Absolutely.
You know, I make my own salve as well. Sorry.
No, go
Yes,
ahead.
there's a lot of elderly in Florida, and I have a lot of elderly patients, and starting them off with topicals is a great way to get started and introduce them to using cannabis. The next step usually is, okay, let's try some CBD now, maybe even the low dose THC. But yeah, it's a nice introduction to topical to cannabis in general.
Yeah.
Stacey,
The
I make my own salves as well. And one way I mask the aroma is I use quite a bit of lemongrass essential oil as just to make it smell nice. And I don't like the menthol smell of a lot of the balms and salves, but I have to say that on a localized muscle spasm, I've found that the salve works really well. Like you say, you may not get into the system to be able to help a more systemic spasticity, but like a Charlie horse or a cramp in your foot, it really works, and it works really quickly.
Right. Or a
Yes.
muscle strain or something to that effect for sure. That's a nice little pearl, Stacey, Dr. Kerr, with rubbing it in until the smell goes away. That's we all can utilize that in counseling our patients about using topicals, because you're right. A lot of people just don't want to walk around smelling like it. Personally, I love the smell of cannabis, so I'm a little odd.
Yeah.
Okay.
Another thought I had was for neurodegenerative disease, is there any evidence that cannabis slows down the progression of, say, Alzheimer's, MS, and even ALS? But, you know,
Yes, the simple answer is yes, there is. But not about all of them. Theoretically, it should slow progression of Alzheimer's and Parkinson's, perhaps, because as it controls the inflammation and the excitotoxicity, it should stop the damage being done by those processes. And that's, we need strong evidence for Alzheimer's, but there was one article that said growing evidence shows that the immune system is critically involved in Alzheimer's disease and in the progression of that. So if we can affect the peripheral immune system, theoretically you can stop progression. Also there's some evidence about multiple sclerosis that in 2003, a study came out saying that agonists at both CB1 and CB2 receptors, the agonists being substances that activate these receptors, they inhibit some of the infiltration of white blood cells, and that does ameliorate disease progression. So that was clear evidence for MS. However, in 2013, they said that pure THC had no effect on progression. So I do a plug here for the entourage effect and not isolating any single cannabinoid to treat these illnesses, because it is plant medicine and there's a reason for all these things to be there. If we can tease out ratios, that's great. But most of the time, we're going to need more than one cannabinoid and perhaps terpenes, although I don't have any specific information on terpenes. Parkinson's disease, it appears that THCV, tetrahydrocannabivarin, it's covered in the module as a factor in decreasing the progression of Parkinson's disease. THCV, if I had a favorite pet cannabinoid, that would probably be one of them. I love THCV and the potential of any cannabinoid that can selectively, perhaps somewhat block the CB1 receptor, but at the same time activate the CB2 receptor. Something tells me that there's gold in that line of research. And I've been looking for many years for a good source of THCV in the plant kingdom and have been unable to locate that as of yet. But I'm keeping my eyes and ears open for any research done on the THCV and getting that available to patients.
I understand that the African chemovars like Durban poison tend to be higher in THCV than some of the others. So it also has some I'm sorry?
It's still very small. It's
Yeah.
higher, but like, 4%. Yeah.
But really, how much do we need? We really don't know.
We don't know because we don't have enough to study yet.
Right.
But
But
it acts similar to CBD in that it modulates the CB1 receptor, it activates the CB2 receptor, it's anti-inflammatory, it modulates glucose metabolism, and it's an appetite suppressant. A lot of similarities to CBD.
Yes, and yet it leads me to want to look into more of what happens if we don't stimulate the CB1 receptors and we do stimulate the CB2 receptors. What does that do for us? I mean, it leads to many roads of questions that need answers.
Well, certainly if we're looking at neuroinflammation, utilizing those CB2 receptors would be very helpful in that they are all over the immune system and depress this, the release of a lot of these pro-inflammatory cytokines.
Yeah. Yes.
So do you think that addressing the inflammation can have an impact on the trajectory of any of these neurodegenerative diseases that plays a part in slowing them down?
Oh, definitely. Neuroinflammation is the big boogaboo, if you will. I know that's not scientific, but here we are. Um, it's it's destructive, and most of these neurodegenerative syndromes, the big problem is neuroinflammation and glutamate toxicity. And so if we can affect that, if we can block that somehow, then we're halfway there. Yes.
And I know that MS is considered an autoimmune disease, and that these cannabinoids can really turn that down, increase the release of the anti-inflammatory cytokines, and really crank down that pro-inflammatory arm of the immune response.
With MS, I have personal experience. My daughter has MS, and prior to her diagnosis, she was not really a cannabis user. And since she was diagnosed, she is using a lot of cannabis. And so I asked her why. And I was looking for spasticity because that's been proven. And maybe antidepressant, because that can help. And she said it just makes her feel more like herself sometimes. She's using quite a bit of it. But I can't really get a specific out of her as, oh yes, it decreases my spasticity or whatnot. It's just, it's part of her lifestyle now. And she's highly functional, runs her own business, but uses quite a bit of cannabis to manage some of those MS symptoms. And so I get a study N of 1 to watch my daughter like a mom does with an eagle eye.
Right.
How much are you using and how much of what, and how is it working for you? And she's highly functional. And yeah, I digress.
Wow. No, that's, these N of 1 studies are impactful and do demand our attention. Just N of 1 is important. So thank you for sharing that and that observation for sure. April 11th was Parkinson's Day. Now, this is not Parkinson's month. Parkinson's gets a day.
Not a month.
Is there a pearl you wish to share with us, since you've dropped so many other nice pearls throughout this conversation? Do you have a pearl to share for Parkinson's?
Cannabis is good.
I like
I
that.
mean, there's some wonderful videos of before and after with Parkinson's.
Yeah.
And I know yeah, it's just people are afraid to use it because a lot of people with Parkinson's are older.
Hmm.
And you got to start low because they're sensitive and go slowly and hold their hand perhaps.
Hmm.
But the effects are dramatic. And I believe we have a really good video in the module
You do.
of
And
a
we
pre
do.
and post Parkinson's patient, and it is dramatic.
Yes,
And
it is.
he doesn't come across as a stoner dude at the end. He comes across as a normal elderly individual.
Yes.
So holding somebody's hand, because usually they're older and they're a little bit afraid of using the evil weed if they've never done it before.
Hmm.
Holding their hand through that, and education, really important. But once they feel the benefits and finding the right dose so that they're not schnockered, but they're better than they were before, that's the key.
And my patients find it very helpful to just do some inhalation, let it set in. Then they can shave, they can eat, they can cut their fingernails, they can do the self-care things that are nearly impossible with that tremor. But it really does take the THC. The CBD hasn't seemed to be very helpful with that. It does seem to be the THC they need.
But I wonder if a nice balance, using some of the CBD in there to attenuate some of the THC effects,
Mhm.
could make it a little bit more acceptable to an elderly person, perhaps, who's never experienced this and has a preconceived idea of the evil weed.
The what is it? The devil's lettuce? Is that what they call it? Devil's lettuce. Yeah.
Yeah. Takes a
Absolutely.
lot of hand holding.
Yes.
There's some dosing guidelines in Dr. Kerr's modules that are really helpful. There's always an issue with the cannabis naive and the elderly in particular. And Dr. Kerr really gives you some very good dosing guidelines. So look for that when you purchase her module, please. The One of the things you said about tremors was that it takes a long time in order to affect the change.
I'm trying to remember that it takes a long time. I'm blocking a little bit, Janister, on a long time, days or moments after dosing. No.
I think the what she was referring to was I think if someone that's using cannabis, like let's say like Sativex, well not Sativex here because it's not available, but like a 1-to-1 or something, and they're dosing either oral mucosally or ingesting, that it can take a couple of months to see an overall effect. And that may have more to do with the reduction in neuroinflammation and some generalized improvement as opposed to stopping the tremor with the inhaling. Or wouldn't it be great if we had nasal? Same onset of action, same duration of action as inhalation, but not available usually. But I think maybe it's the overall improvement may take a couple of months to see.
Yes, and that's a challenge when you're dealing with somebody who's never used this before and is already a little afraid to use it. As many of the people who have these conditions who are naive to the medicine are. They're, oh, I'm not sure about this. And then it doesn't work right away, so they give up. So holding their hand and encouraging them in ways that, see, you didn't have any side effects and you didn't turn into a monkey. Keep doing it. That can help them continue to get benefit. I have many patients who try it and they'll call me a week later and say, no, it didn't make a difference. And they don't do it anymore. And they just need to keep going, and they need a bit of hand holding to do it when they're an elderly person who's never used it before, and they're a little scared by their diagnosis too.
Yes, absolutely. So we have about just about 20 minutes left, and I'm wondering if we have enough time to address some of the questions. But before we go to questions, is there anything that we didn't ask about that you feel like you would like to share with our audience?
Oh gosh, you caught me flat-footed there. Let's see. What do I want to say? I essential tremor. I wanted to say really quickly that a lot of people have essential tremor, and THC and THCV seem to be beneficial for that syndrome. It's a hard one to treat. Restless legs, we cover that in our module. And Alzheimer's, we cover that. The thing about Alzheimer's is sometimes Alzheimer's patients lose their appetite, and if you pick the right strain, you can bring that back for them, and that's nice. Huntington's disease. We cover all those in the module, and the reason they got covered is because there are good effects. And let's see, there was one other thing I made a note of, excuse me here. Nope, that's good. Let's open it to questions.
All right. Let's see what we have here.
So the first question is there research showing how cannabis can be used preventively to avoid Alzheimer's or other neurodegenerative disorders?
Preventive use of cannabis. I do not know of research on that. I find it interesting. I make note so I can look and see, but I think we're early in the science to have good documentation about that, because that takes time to prevent it and then see would they get Alzheimer's anyway, or we just don't know. Theoretically, it makes sense. It would be very interesting to do a survey of lifetime cannabis users. It would not be scientific, but it'd be interesting. Lifetime users, and see what the incidence of Alzheimer's is in them compared to never users. And that would be a start. I'd be interested in the results of something like that.
And there may be some relation. I know there's a question about traumatic brain injury and glutamate, and sometimes after a stroke, where you have, it's not the area where you lose oxygen delivery, but it's that spread of damage that occurs later as you have increased glutamate secretion, and they have found that in some shock trauma patients that the tendency is that the area of damage is smaller in those patients who are cannabis users versus those who do not use cannabis, and the recovery is faster. So there certainly may be some benefit to chronically using these cannabinoids in terms of how the brain reacts to injury or to an inflammatory process.
Correct, and theoretically it would be beneficial because of what we already know about the effects. And I know when I was first doing this work and I realized it was neuroprotective somewhat, I think I added something to my own durable power of attorney that if I have a stroke or a head injury, please load me up with as much THC as you can get into me while I'm in the ICU, and give me the best chance at recovery. Thank you very much.
There you go.
There you go. That's excellent. Another nice little pearl.
All right, what's our next question?
All right, so that brings us into our next question. Is there any research showing the effect of cannabis on neurogenesis?
There may be. I'd have to go look through my files of 4,000 scientific articles. It's an interesting topic because pregnant women who use cannabis obviously are affecting neurogenesis. People who are recovering from nerve trauma, strokes and whatnot, is it good for them to use cannabis to help with that? Um, I lived in a community for many years where cannabis was used regularly, and we were having a lot of babies because we were that age. And I was able to do a survey years ago of the people who had children now that they grew up. How are they doing? Are they different than the kids who were not exposed to cannabis while you were pregnant? And try to do a unofficial, it wasn't publishable, but that community gave me a good group of people to ask the question of. And it didn't appear that it made huge effects, according to my little survey, in harming any neurogenesis. These kids were smart and active and, like most kids, there were a few challenged ones as well, but not more than you might expect. So I know it has effects on neurogenesis, but I'm not sure those effects are bad.
Yeah, and
You know that the farm on which you lived, you all also grew your own food, and there were a lot of shared responsibilities. Is that correct?
That is correct. It was the largest commune in the United States. There were
Right.
about 1,500 of us there.
Right.
And when we had the herb, that was the only substance we used.
Right.
And
So the fact that the kids seem to be okay, or at least not much different than kids who weren't exposed, could be attributed to the fact that there were no comorbidities, nor were there any co-use of substances going on, and it made it so it may not have been as detrimental as some people or some studies suggest that it might be in pregnancy on the children. So that's an important factor. The fact that there
yes,
was good nutrition, plenty of exercise, a clean environment, and all those things are really important. Stress can cause a premature delivery. So
yes,
there are
yes.
many things, many factors. It's a multifactorial situation. So no one thing is going to change it if you have all the other factors in place.
That's
That's
correct.
a really good example, Dr. Kerr.
Yeah.
Kind of similar to the Jamaican study.
That's right. That's right. Yes,
Yeah.
it's hard to control for all the variables.
Right.
Our diet was not always great because we were living in the woods of Tennessee and didn't have enough money some years. But we did get a lot of exercise, and we had wonderful births, and many of us used a lot of cannabis during those days when it was available. But you're right, it was a controlled environment in ways that we don't have right now, and hard to say what affects what.
Right.
There's certainly some mouse studies that show the neuroplasticity associated, at least with cannabidiol, and its effect on growth factors. So we just don't have any studies in humans except anecdotal, looking at recovery from closed head trauma or traumatic brain injuries or strokes, where anecdotally, yes, these patients do tend to recover faster and more completely. So one would assume, which we really shouldn't do, but we would assume that there is some benefit from these.
Well, we start with assumptions. We create theories based on those assumptions, and we don't tell anybody we had an assumption. We come up with a nice official theory, and then we design a study to try to prove or disprove that theory. And of course, the problem with this one is you're dealing with pregnant women and unborn babies, and the stakes are so high, it's very difficult to do good studies on that population.
It really is. It really
Okay.
is.
Do we have any other questions?
Yes, we do. So our next question is, can CBG, G as in girl, replace THC if someone is opposed to using THC?
No, it can't replace THC. That's a simple answer because they're two different things and they have different effects, and nature gave them to us for different effects. CBG is good. It's been shown to be helpful in Huntington's disease. And I'm sure it's good in other things as well. I'm not sure, I don't have in my head that the fact that whether CBG attenuates some of the intoxicating effects of THC. But I know many people are hesitant to use any THC. They don't like the effects and they don't want them, or they're scared of it. But you can't take one cannabinoid, I'm sorry, and replace it with another one and have the same effects, any more than you can take an apple and expect it to taste like that orange that you can't eat.
They definitely activate different receptors. CBG is a really good anti-inflammatory. And it also, as we mentioned earlier, it directly interacts with that glutamate receptor. It can increase GABA and decrease glutamate. So you may have some benefit from CBG, but it's going to be a different mode of action. It's not the same as THC.
That's correct, Patricia. And also, it can, if we combine some of these intelligently, we can attenuate some of the intoxicating effects of THC.
Absolutely.
Actually, I read that THCV can do that. THCV actually mitigates some of that impairing effect, just like CBD. CBD's first cousin, THCV.
But also, if somebody starts really low, like 1 milligram of THC, maybe they won't even have any intoxicating effects, and that will desensitize them to the fear of going totally crazy when they get high. And some people really don't benefit from the intoxicating effects of THC, but if a little bit is needed, it can be balanced and managed by medicine that has several of these other cannabinoids in it that mitigate some of those intoxicating effects.
Maybe that
Another
4%
method is
THC.
also to have patients take their THC at night, and they'll sleep through any impairment or intoxicating effects and still reap the medical benefits of using THC. So that's also another way to get THC into people.
Yeah.
Sure.
And also, if THC is needed in very high doses, rectal administration has been used because I'm getting into some science here, where it doesn't, when you put a rectal suppository in with a lot of THC, a lot of that THC does not go through the liver, where it gets turned into an even more powerfully psychoactive substance. So you can avoid some of that by doing rectal administration, and you still get the THC into the body.
Right.
Yeah.
You know, as
THC
physicians,
can be succinate. Yeah.
as physicians, we can talk to our patients and guide them. So it really, we can allay those fears and we can help guide them through so that they can take full advantage of the benefits of cannabis medication. It's just such an amazing multifactorial plant that I'd hate to leave anything out. So just guide your patient, hold their hands through the process. It works. It works.
Yeah, just like I did my friend on the deck looking out over the view.
Right.
Was scared, 2 tiny inhalations, and she was happy. And there's nothing like it for a physician who cares about the patient in front of you, to see them change from gray to pink,
Amen.
from struggling to joyous.
Amen. That's for sure.
All right. Our next question.
All right. There are studies that show that ketamine affects neuroplasticity in glutamate receptors. Have there been any preliminary studies with regard to cannabis, specifically to glutamate?
Well, we talked a little bit about that already, that both CBD and CBG directly affect glutamate secretion, and by decreasing it and increasing GABA in the situations where there is too much glutamate. A lot of those studies are in mice, but there are also been some studies looking at brain tissue and central spinal fluid in autistic patients where they have a glutamate GABA imbalance for sure that causes neuroexcitability and irritability. So yes, there are some studies looking at that and the effect on the glutamate GABA glutamate system. Another question?
Yes. Let's see here. Have you had an occasion to use cannabis for prior disease to slow progression of symptoms?
Myself having experience using cannabis for somebody who already has Alzheimer's or essential tremor or Parkinson's, is that the question?
Yes. Have you had an occasion to use cannabis for prior disease to slow progression of symptoms?
For someone who's already been diagnosed with yes, that's what we.
Yes, well, we're recommending cannabis for symptoms, and when it works, then the patient has less symptoms. And does that mean the disease has not progressed? Well, imaging might help us with some of these. But as we discussed a little bit earlier in this hour, there is some science that shows it does stop the progression of a couple of these neurodegenerative disorders. And theoretically, by treating neuroinflammation, glutamate excitotoxicity, it should slow the progression. It's not curative, but when it's the right medicine for the right individual, it can help immensely with the symptoms. And also, we shouldn't forget the added benefit as an antidepressant, if you will. The right amount, even tiny amounts, can bring the color back to someone's life in a way they had not anticipated.
Okay.
Yes.
Awesome. And then one more question. Head injuries can increase glutamate toxicity, excitotoxicity. Have you seen a connection or correlation?
There's good data on, I think it's mostly THC with head trauma, brain injury. Enough that when I was working on the first edition of the education module that the society put out, the information about the use of THC in brain injuries was strong enough that I even added it to my own advanced directive. If I have a closed head injury, please load me up with THC. If I get too stoned, if you will, I'm not there, I'm unconscious, it's okay. Just pour it into me as high a dose as you can, because it looked like even if it was even for a short period of time, it could increase my chances of returning to the world. Yeah. And that's pretty strong statement from me.
Yeah, there are a number of murine studies looking at CBD and neuroprotection and actually cardioprotection as well, where they do some mouse studies, pre-treat some of the mice with CBD, and then cause those mice to have a stroke, an ischemic event, and they find that the damage is much small, the area of damage is much smaller, the recovery is faster, and the recovery is more complete with the pre-treated mice, and that was with CBD. And then the similar studies looking at cardiac tissue, giving these, pre-treating some of these mice with CBD and then giving them a heart attack. Those mice that are pre-treated with CBD do better. So I think there's something to be said for neuro protectiveness and probably most of, if not all of these cannabinoids. It's a matter of looking in at studying them. Certainly the Department of Health and Human Services has had a patent on these cannabinoids, and they don't single any one out, as all of them as neuroprotective and as antioxidants. And that's what you want when you're having ischemic damage to any type of tissue.
And that's a good point, Patricia. It's the entourage effect again. It's one of the reasons it's difficult to study this medicine and to work with it, if you will, because our culture wants single item medicines in specific doses. And
that's what we're used to. That's the pharmaceutical company.
Okay, how much THC do I need? And I've gotten questions from other physicians saying, oh, I heard they found out where the medicine is in pot. It's in CBD. And there's a lot of education that needs to be done.
There's a lot, yes. And we're too used to the pharmaceutical mode of action. That's a single molecular mode, and that's what we look for. Take the active ingredient out of the plant and make it a pharmaceutical agent so you can patent it and make money, and then deliver that. And they've been trying to do that for years with cannabis, and you just cannot do it.
That's right.
There's too many active ingredients. They're all active.
And as I touched on dosing, I know we're coming to a close here. I think we are anyway, but I just wanted to say that dosing is where the experience of a good practitioner comes in so handy. And of course, starting low, going slow, but everybody's different. And while that can be daunting, I do try to educate people that we all have our own skin color, we all have our own hair color, we all have our own endocannabinoid system that is unique to our own being. And therefore, this medicine interacting with our internal endocannabinoid system, it's going to be different for each individual. That can be daunting, but you can spin it. It puts the control into the hands of the patient. You decide what works for you. I'll help. I'll hold your hand. I'll give you guidance. But it's up to you what works for you. And my knowledge, working with what you feel, together we can reach a point where you may be getting the best benefit possible at our current state of knowledge that you can have for now.
Yeah. This has really been great, Dr. Kerr. This really has been great. Thank you so much for all of your knowledge, your wisdom, your experience, and feeling so free to share all of it. It's really been enlightening, informative, and a great lunch hour.
Thank you so much for the opportunity. And we'll keep on learning from each other and from our patients and from science. Absolutely. And we're going to have a lot of fun doing it.
That's right. That's right. I want everybody to continue to follow the SCC on our social media, become an SCC member, and there's a lot of perks with that. And for example, you get to review these events for free. Anytime you have access to everything we do and what we record. So please feel free to partake of all the SCC has to offer. It is the premier cannabis clinicians entity in the country, actually in the world, because we are worldwide. We have 3 or 4 chapters. We have the Colombian chapter, we have the Australia chapter, we have a UK chapter, and we're spreading our wings and flying. So please fly with us. So thank you all for this time. We're going to close shop now. And I'd like for the SCC team, 4 members, to stay on the Zoom for a little minute. Oh, speak of Zoom, I wanted to share one other thing with everyone. Dr. Kerr is the one who introduced Zoom to the SCC many years ago. So we all need to thank her for that. All those quarterly meetings and whatnot are on Zoom are because of Dr. Kerr. So please know that. So thank you all and have a beautiful day and rest of the week.